Beauty is not just the external part, it's the internal part too. So if you feel good, if you are happy, if you have energy, and then you're healthy, and then that's beautiful, and then you can do whatever you want to do in life.
I think beauty is imperfection.
Yeah, we have to be perfectly imperfect, and that's beautiful too. So, and
Beauty is also confidence. I think it's very hard to feel confident when you feel terrible. So I think taking care of the inside is the starting point, because you can't feel confident, and confidence goes a long way with how you approach your family, how you approach work, how you approach just day to day. And I think that that is a big part of beauty, is just the confidence.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Giselle Casteluber, a board-certified family medicine physician with advanced training through a fellowship in functional medicine. She is passionate about bioidentical hormone replacement therapy and aesthetic medicine, integrating evidence-based medical care with strategic lifestyle changes to elevate health, wellness, and natural beauty. Dr. Giselle believes in a personalized, whole-person approach, helping patients feel their best from the inside out. Now, Christine Casteluber is a board-certified nurse practitioner with a critical care foundation, now channeling her clinical expertise into functional medicine and aesthetics at Inspire Med Spa. She partners with patients to address root causes, from hormone to thyroid optimization to personalized aesthetic treatments, moving beyond traditional medicine pushing to holistic, results-driven care. She is dedicated to growing Inspire Med Spa into a unified destination where wellness and beauty seamlessly converge, helping clients look and feel their absolute best. So Dr. Giselle and Christine, welcome, and glad to have you both here.
Thank you.
Yeah, so let's dive into this. Let's start off with this. How did each of you get interested in the medical field, kind of from like the high level?
I was raised with a doctor. My father was a physician, and I always knew I wanted to be a doctor. In the family of five, I was the only one, the only doctor from the family of five.
Mm-hmm.
But and I went to university medical school, and here I was, and I graduated in Brazil, and then I did my training here in the U.S. also.
Okay. And so when you got started in medicine, what was it that transitioned you more into the aesthetic side and the wellness side?
For personal reasons, for health, after the residency that I did here, I was very tired. I didn't have any energy, and I did my blood work, and nothing on the traditional medicine could help me. So I always looked for the alternative. In Brazil, I used a lot of alternative also, and I found the A4M, the functional medicine, and I fell in love with it. And I think that was answer a lot of my questions and a lot of more help that could be given to me and to my patients.
Okay. And Christine, how about yourself? How did you get interested in the medical field?
Well, my mom has brought all of her knowledge to the house every day, so this is what I grew up with. And I'm also type 1 diabetic, so I always kind of knew that I wanted to go into medicine just from a very young age. And then, like growing up with my mom, the way that she talked about medicine and spoke about everything, that just seemed right, and it just felt like that was the how things should be. So when I was in school, and then I was doing all my trainings and I was following all the doctors, it felt like they were just pushing a lot of medicine, and it wasn't really a system that looked like they were trying to find the cause of something. It was just putting a band-aid over things and then like next. And that just never felt right.
Mm-hmm.
So then, when I started shadowing my mom before I graduated, and this felt right. Like, she never forced me to come into this by any means. She actually told me do something else.
Yeah. I told her I want you to find what you want to do, because I don't want her to join me and then hate it. That's what a big no-no.
So then when I started shadowing her, and it felt like we were doing something, we were actually helping the patients. It felt like we were getting to the cause. And then what the response was from the treatments, from hormone replacement, thyroid, people are genuinely feeling better. And that's what I went into medicine to start with, to help people. And that's what was in aesthetics. I have a very like creative mind, so it kind of just was blending the science with the aesthetic, the creativity part of it, and it all just fits.
Yeah. So is that kind of what prompted starting up your own practice instead of just working at another place?
Oh yeah. I was always a different duck.
Uh-huh.
In this way,
Yeah.
I could never fit on the regular mindset of a business here on medicine. And I didn't want to have to do all kind of things that they were doing. And then I decided like I would work part-time and make time to develop my own practice. So I started slowly building my practice. And then in 2001, I opened my own practice
Mm,
until today, you know.
okay.
And,
Now,
yeah.
within your practice, I want to dive a little bit deeper into the treatments that you provide. I want to start off with the hormone replacement therapy, HRT, because I think some people may have heard of what this is, but for people who have no idea what hormone replacement therapy is, could you kind of give like an overview? What is it and how can it help people?
HRT, meaning hormone replacement therapy. So when women go through menopause or perimenopause, and then they start having a lot of symptoms, and then we check it out to see which hormones are missing, what's going on, and then we start like guiding them and replacing whatever they need. And the approach that I use is the bioidentical ones. That's because its body is identical to what the body produces,
Mm,
and we are able to see a lot of change. We are able to help a lot of our patients that are going through that.
okay. And you specified bioidentical because it's similar to what the body produces. I'm assuming on the flip side of that, the other one would be synthetic. Uh,
Yes.
so in that case, like what's the difference between the bioidentical and the synthetic?
The synthetic meaning the structure, the chemical structure is not equal to our body. So it doesn't react the same. And
Mhm,
that's the difference. For example, Premarin. Premarin is made from the horse urine.
mhm,
That's nothing to do with our body.
mhm,
Provera is a progesterone that's synthetic. They have adding chemicals on the at the end of it. So the results in our body is completely different than we want to. No wonder they came to that study. They made a big mess about hormone replacement. It's bad for you. It's not. It's caused cancer and this and that. Thank God, recently the black box warning was lifted, right? So
mhm,
that's a big help for people to try to understand that's it's very good for us.
Yeah.
mhm. Okay.
If you think of like a key, like it fits, but it's not a perfect match. So the way that the body reacts to that, they can have different kinds of side effects, and there's just different. It's not responding the way that your body normally does to the hormones, and that's what can cause a lot of issues in the long term.
Okay. So, in what conditions would people be having where they should start looking at hormone replacement therapy? Because I think if people who have heard about it maybe a little bit, it's like, okay, well, it's for people that are older, but I really don't know like when I should get it or what under what conditions I should get it. So, what maybe symptoms would they be experiencing where they should start looking at hormone replacement therapy?
The age varies because each women go into perimenopause or menopause in different ages. When they stop having their period, that's a say one thing. The
Mhm,
other thing is increasing in PMS. Oh, the menses, the menstrual cycle changes, and then the insomnia and irritability, mood swings, all those things are
mhm,
very common, and decreased libido, decreased strength. All of those are symptoms that we can check the hormones at the right time of the cycle to see what if they are needing anything.
mhm. Okay. And when it comes to difference between men and women, I think people who know a little bit about it would just be thinking, okay, for men it's testosterone, give them more testosterone. For women it's estrogen, just give them more estrogen. Is it really as simple as that, or is there more nuance that goes into it?
I wish it was that simple. Men is simpler because what we replace is testosterone. And usually when they in the late 40s or mid 40s, sometimes the stress is too much, early 40s, they start needing testosterone. It's much more straightforward for men. For women, we need estrogen, we need testosterone and progesterone. And
Mhm,
it's kind of a symphony. We have to balance those three. and then the person can, then they say, oh, why don't I just take estrogen? If I say, no, no, it doesn't work that way. It has to be all balanced out because one balances the other. And then it have to be like that. If I replace just one, we're going to have a lot of side effects. Can have
Mm,
a lot of problems. For example, if I replace only testosterone, it can cause atherosclerosis. So all your vessels can be damaged because of that, because you don't have the estrogen and the progesterone to balance
Protect
everything
it.
out.
okay.
It's also symptom based, so we're not just going off of labs. Some people are just a little bit more sensitive to the hormones, so we have to take that all into effect. We're trying to give the lowest dose to relieve their symptoms.
And to maintain, to give a normal, a
Yeah,
physiological level.
yeah.
It's not just the minimum, and we want them to protect their bones, the memory, the lifestyle, the muscle, and prevent osteoporosis, dementia, all kinds of stuff.
Mhm.
That's
Mm,
what the hormones does.
got it. Okay. So for people that are just starting off with this, I guess where do they start? Do they want to come in and basically check, get their labs done to kind of figure like where are they? What are they missing? Or like I guess what does that beginning process look like for most people?
They come to the doctor, and then we see their symptoms. We see if is okay, if they kind of belong to that people that going through this, and then we draw the labs, and then we need the pap smear, the mammogram. All these things should be in on time to be able to start replacing it.
Okay. And when it comes to the length of time that they should be taking, is it one of those things that once you get on it, you stay on it kind of for the rest of your life? Or is it like how do you balance that? Because I think when people, and I'm kind of comparing it to like the GLP-1s before, people's like, oh, if I just get on this, I'm on it for the rest of my life to kind of get this. But I guess the same thing could be said for like supplements. Well, people take supplements ongoing. So could you kind of dive a little bit deeper into that? Like once people get on it, do they typically stay on it for the rest of their lives?
Yeah, that's a very question that my patient asks. How long would I have to be on? I explain to them, like, when you're menopausal, you're not going to become non-menopausal.
Mhm.
So when you reach that stage, your body's not going to start producing the hormones anymore. So it's just a replacement. If you stop taking the hormones, all your symptoms going to start coming back. Everything's going to start. So it's probably a lifelong, therapy.
Okay. And is it because just the body's no longer producing enough hormones on its own to maintain that balance? And that's why basically you're putting these extra hormones in to go get you back to balance.
Yeah.
Yes.
Mhm.
Okay, got it. Now, I want to talk a little bit about delivery methods. As far as like, is this like a pill you take orally? Is something that you just like wipe on your skin and your skin absorbs it? I think that's something called pellets. Like what's the difference between all these different delivery methods?
So there are, as you mentioned, a bunch of different delivery methods. Progesterone is usually given orally as a capsule because it gives the benefit of helping with sleep.
Mm,
Um, if it can also be done as a cream, but you don't get those effects of sleep. And a lot of women in menopause do have issues with sleep in
mm,
general. The testosterone and the estrogen have a bunch of different forms, so it can be done. We personally do creams and sublingual troches. Um,
It can be patches
it
that
can be, yeah, it can be patches, and then there are pellets. We don't really like the pellets. It's one of those things that because people are very sensitive to the hormones, once the pellets are in, if they're going to have some kind of reaction, you can't take it out. But I
mm,
do know that some people also love the pellets, so it's kind of figuring out the way that you like to take it the most. Some people start with the cream, go
mm,
to the sublingual troches, try pellets. So it's kind of figuring out the best method for you. And because this is such an individualized treatment, we can make these adjustments.
mm.
and testosterone can be
Okay.
injectable also for women and for men.
Mhm.
Okay.
So it has a more direct effect.
Okay.
And
So it's really just dealer's choice, which one you kind of prefer, which one you want to start off with, and then from there, if they want to just try different methods, you can just try it and see is it
yes,
more effective or less effective.
Yeah.
yeah.
Testosterone can't be taken orally though, because it
Mm,
does affect the liver.
okay.
But lately
Oh yeah, there is a
yeah,
there is a
there is
new
one pill now that they just put it on the market that supposedly can be orally,
oral, yeah.
but it's crazy expensive. I
Mm,
don't think it's gonna be like a regular thing.
Yeah, okay. So then when they start this journey, because I mean, it's all about trying to get them back to balance. And I don't know if it's just a cut and dry, oh, you're at this level, take this amount and you'll go back to the regular level. I'm sure there's a lot more nuance to it than
Oh
that.
yeah.
So how often are people coming in and getting, I guess, measured? Like, hey, take this dose, and then how often before you check, okay, you're on the right track, or hey, we need to adjust a little bit. How often do they need to come in, I guess, for that checkup to see are their levels going back to stasis or to balance?
We usually do every 4 months, and we alternate blood test with a saliva test
Mm,
because the saliva test is much more efficient on saying how much of the hormones in the cell. And then in the blood, sometimes the hormone, if you put in a cream or sublingual, and it doesn't go through the blood, it goes straight to the receptors of the
mm,
cell. So when you do saliva test, sometimes it's much more
Accurate.
accurate.
okay, good to know.
But
Now,
because women's hormones are changing so much during perimenopause, it it's very hard to get a very stable dose
Right away.
right away. Yeah, because the levels are changing so much.
mhm,
But then once menopause is reached, it's easier to get like a level and
And depends on how much stress they're going through, changes in their life, separation, death, things like that. That affects everything because it affects so cortisol level and everything. So everything is kind of intermeshed, it's interconnected. And,
mm,
and what we use for balancing out is like we see the patient's symptoms combined with the results. It's not just the lab result. We have to kind of associate one thing with the
Mhm.
other.
I see. So, but and that kind of brings another question up in my mind for perimenopause in particular. Since you mentioned there is a lot of up and down with the hormones, how are you trying to get that balance? Is it just you're checking more often, or just during the perimenopause phase, you just have to kind of deal with a lot of volatility throughout that period, or like how do you approach that?
We kind of try to imitate the cycle. So
Mm,
give some estrogen and the progesterone on the
Correct days.
correct days. At the beginning of the cycle is more estrogenic. On the end of the cycle is the luteal phase, so you need more progesterone. So we try to kind of imitate that to give the patient more stability, so they can have their regular menses and don't go crazy, don't want to kill anybody or stuff like that.
Okay. Now, when it comes to, because I'm sure there's a lot of misconceptions or one you brought up was the I think it was the FDA was say there was it's causing cancer, but they finally reversed it, I think about a month or so ago.
Yes,
Uh,
yes, very
I think
recently.
I think that was one of like probably the biggest misconception about hormone replacement therapy. But from what you hear from your clients and your patients, what would you say some of the most common misconceptions or myths that you hear when it comes to hormone replacement
Yeah,
therapy?
it's you shouldn't use it because it causes cancer. You shouldn't use it because it's very dangerous for you. Or this,
We get a lot of weight gain too. Am I going to gain weight taking the
the
hormones?
hormones. Yeah, I'm gonna be like a balloon. I said, no, no
Mm,
way.
If
You-
anything, it helps. It doesn't help you lose weight, but it does help stabilize things so that when you're going to lose weight, or if you are going to gain weight, you won't just gain it abdominally because that's one of the things that happens with menopause. And then it also helps, like I said, regulate everything. So when it kind of helps you lose weight is like a
Helps the metabolism goes
yeah,
back to the normal
yeah.
because the metabolism gets stuck in menopause because everything's kind of wrong. It's not corrected, and then it doesn't work. And then the women end up getting like in the chest and in the stomach area. So
mm,
they become like a barrel kind of thing.
mm.
And when you start with the hormones and everything start like going back to normal, of course you have to adapt with the diet and the exercise. Everything goes with that.
Okay, got it. So let's say that somebody is looking to get hormone replacement therapy done. They're looking around for a provider. They don't know anybody. As they do their search, what advice would you give to this person as they do their search to find a provider that is knowledgeable, can get them the results, and that is just they can be comfortable with? What advice would you give to that person as they do their search?
Make sure that the provider is giving bioidentical hormones.
And they have a website on the one that I know of is the A4M,
Mm,
American Academy of Anti-Aging. They
mhm,
have a roster of doctors that graduated from them. They have a training in that also.
mhm,
And and I think the most effective is from friends that they were doing it, and then they say, oh, go to this doctor, go to that doctor because I'm doing it, I'm feeling great, and this and that. So that's the something like that. But you have to have results, and
Mhm.
then when we're doing the right thing, I think the results come.
Okay. Now, I'm curious, what role do you think creativity plays in what you do? Like, how important is it to have creativity? Because I think when people think about medicine, creativity is probably not very high on that list of priorities when it comes to medicine. It's like, I don't want you to be creative, just like follow the protocol. But with what you do, how important would you say creativity is?
Well, I mean, this is all very individualized, so you do kind of have to be creative on like the approach because everyone's lifestyle is different. So it's kind of seeing what works for them because I can give you 100 medications, but if you're not going to take any of them because of a specific reason, then we have to adjust. And it's really getting to know the person and picking something that's going to work for their lifestyle. So that in the aspect is creative. And then the aesthetic side is you have to have that aesthetic eye to do it because anyone can be taught kind of how to do it, but if you don't have that eye, it's just not gonna it's gonna look okay.
Yeah.
Yeah, it's not it's the artistry of
Yeah.
the business. You can do practically you do this, but if you don't have the refinement of doing the way the person wanted, and then we have a motto here that we have to enhance who you are. We don't gonna have to change you, and then we're not gonna change people's face. We're just gonna enhance and make better, make them look relaxed, look like not
Tired.
tired, and then they 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 get very satisfied because
Okay.
they're very afraid of the frozen look or the
Yeah.
looking like a
Pillow, yeah,
yeah,
pillow
pillow
face.
face and
Mhm. Okay. And I guess tying into the when they're searching for a provider, is there a way that they can kind of tell, does this provider have that artistic eye or not? Like, are there any kind of telltale signs?
I would say look at the provider and the staff because
Mm,
usually they're going to tell you their vision of beauty. So if like some people really like those really enhanced lips. If that's what the provider looks like or the staff looks like, you can kind of expect that's their eye of beauty and like that's close to what you're going to get. It's if the providers they're much more natural looking, you can kind of expect that the results are going to look like that as well.
okay.
and you have to see what their work are
Yeah,
too.
but the
For
before and
example,
afters, ask for
yeah,
a lot of before and afters, look at reviews. It's all, it's a lot of word of mouth because it's just, I feel like that's kind of this business, is word of mouth.
Yeah, I get that. Okay. And so I'm sure that throughout your experiences, both of your experiences, there may be stories or cases that are just memorable or maybe even challenging. Is there maybe one story that comes to mind that you can share, just a memorable case, a challenging case, and how you were able to get them a great result in the end?
oops. You remember anything? I remember one patient that when I started doing hormones, and then she almost kind of grabbed me. She said, like, if you don't give me my hormones, I'm gonna kill somebody, because some women can have that kind of reaction. I said, like, oh, take it easy, we're gonna get there.
Mhm.
Then we started like a replacing, and then she calmed down, and everything was much more normal.
Mhm.
And because of bioidentical hormone therapy, also, if you don't have it on the marriage side of it, it can
Mm.
be very difficult. And then another patient was saying, like, I'm ready to sign my divorce. And then I said, like, no, 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 let's work on this. Ask for some time. So we have time to start like fixing things so you can have a more normal, intimacy, married life, and things like that.
That's a very interesting point because I've never really thought about that. Is that hormone replacement therapy can actually save marriages because it's
Yes,
very
yes,
it's often not because they just don't get along. It's just because the hormones are all over the place and it's causing this turbulence. So
yes,
I
yes,
never
and
thought of it as if people having trouble with their marriage kind of late on in life, it could just be the hormones and you get this treatment and then that'll fix everything.
yes, because if you have no hormones, and then the women don't want to even look at their husband, so go away from here,
Yeah.
and then they feel like left out, and then all the trouble starts from there.
Mhm.
The
Okay.
women majority don't even know what to do with that because they don't understand what's going on, and then
Okay.
so it's something that can really help.
Yeah, they definitely something to consider. So now, where do you think the future of wellness, hormone treatment, where do you think that the future is going with that?
I think it's expanding a lot. There's such a connection also between your hormones and your skin health. So because of that, I think a lot of the aesthetic practices are now incorporating just general wellness with hormone replacement. Because it's really hard to get healthy looking skin without having your hormones balanced as well. So I really do think that, especially now with the black box warning taken off, that there's going to be a pretty big expansion on overall wellness, and like social media too. It's talking about it more, so more people are just aware that it's an option and that they don't have to suffer through menopause and perimenopause. So I think that now there's going to be a big boom in bioidentical hormones.
Okay. And
And
for your practice, Inspire Med Spa, what's your vision for the practice?
I think we're just incorporating and then getting more access for the people to come in and then get their care, and then enhancing if they start feeling well inside, and then they'll know, now I want to take care of this or that, and then we kind of integrate everything, plus vitamins, IV vitamins, and all the other supplementation, and I think, and then we are looking to peptides also. I think peptides is a big next level thing that's going to happen too.
Okay. Well, it sounds like it's a great vision for the practice then.
Yes.
Now, Dr. Giselle and Christina, I have one last question for you, but before I ask it, I do want to point people to your website at inspiremedspa.com.
Yes.
Now, last question is, what does beauty mean to you?
It's such a very like complex, because beauty is not just the external part, it's the internal part too. So if you feel good, if you are happy, if you have energy, and then you're healthy, and then that's beautiful, and then you can do whatever you want to do in life, and then you can enhance the outside, and then you go and then you take care of little details here and there, and you don't have to be perfect to be beautiful. I think
Beauty is imperfection.
we have to be perfectly imperfect, and that's beautiful too. So, and
beauty is also confidence. I think it's very hard to feel confident when you feel terrible. So I think taking care of the inside is the starting point, because you can't feel confident, and confidence goes a long way with how you approach your family, how you approach work, how you approach just day to day. And I think that is a big part of beauty, is just the confidence.
Awesome. Well, there you have it. Dr. Giselle and Christine sharing their expertise. Now, where can people contact you in your practice?
we are available on the phone, and then we have the messages, right, Christine? They can give it messages, website,
number, our website, and also Instagram. It's at Inspire Med Spa, or just at Inspire Med Spa is our Instagram, and TikTok also. And we are starting a YouTube channel.
Nice.
a
Okay.
little in the game, but
Okay. Well, this is awesome. Thank you, Dr. Giselle. Thank you, Christine, for coming on and sharing your knowledge and sharing your message.
thank you so much for interviewing us.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.